Hi, I'm Andrew Albright, a physical therapist here at the James, and I work closely with your medical team to help you have a smoother transition after your surgery. After your surgery, it's important to allow healing to take place and not disrupt your surgical incisions. So when you have your catheter in for about a week or 2 weeks after your surgery, it's important to kind of maintain an activity level, but gentle. So go for a gentle walking program, maybe 5 or 10 minutes at a time, but several times throughout the day, or what your body can allow for that day. This is a very safe way to allow you to keep moving while letting your surgical site heal. Once your catheter has been removed, it is safe to begin Kegel exercises, or the exercises to strengthen your pelvic floor. Strengthening the pelvic floor muscles will help you regain bladder control after your surgery. Kegel exercises can be done in varying positions, but they can also be done nearly anywhere. After your surgery, when you're starting an exercise program, it's important to note how you're feeling when you're exercising. If you start an exercise program and you start noticing pain throughout the body, lightheadedness, chest pain, or your heart racing unexpectedly, take a break, rest, come back to it, and if it continues, to contact your medical team. Now let's talk about how to perform those Kegel exercises correctly. Kegels, or pelvic floor exercises, can be very challenging to learn. So if you're having a hard time picking up on what I'm asking you to do via this video, then please reach out to your medical team to get a referral to come and see a pelvic floor physical therapist to help you in person. It's important for you to do these pelvic floor exercises correctly. We don't want you to constantly be doing the wrong exercise over and over and over. One way for you to find your pelvic floor muscles on yourself is to do the urine stop test. The next time you're emptying your bladder, try stopping that flow midstream. You need to contract your pelvic floor muscles in order to stop that flow. And if you have good strength in your pelvic flow, you'll notice a slowing of that urine stream or even a stopping of that stream. After your surgery, this will be challenging, and it's to be expected afterwards. So if you're having a hard time again picking up on this, please come and see a pelvic floor physical therapist and we can help you. When you're doing a pelvic floor exercise, it's important to isolate just the pelvic floor muscles and not tense or contract your leg muscles or your buttock muscles. If you're watching this video and you feel like you have a handle on what a Kegel is, then let's talk about the different types of pelvic floor exercises out there. There's quick contractions and endurance contractions, both very important. The main difference in these two different types of contractions is how long you're actually holding the Kegel exercise. Quick contractions are only held for about 2 to 3 seconds. So I want you to kind of lie down and get comfortable when you're doing these exercises so that you can really focus on just feeling your pelvic floor moving. I want you to take a deep breath in, and when you exhale, I want you to try to lift your pelvic floor up for that exhale. And if you're just maintaining a normal breathing rate, this should be a couple second inhale and a couple second exhale. But take your time. You're learning a new task, so don't be upset when you don't get it right the first time. Again, when you inhale, your pelvic floor is relaxed. When you exhale is when you contract your pelvic floor. I want you to repeat this exercise 10, maybe 15 or 20 times in a row. You can do it a couple times in a row or give yourself a break throughout the day. Maybe you do some in the morning, maybe you do some in the afternoon, maybe you do some in the evening. On top of the quick contractions, there's endurance types of contractions which are going to help you maintain longer bouts of continence. Endurance contractions are just held a little bit longer than the 2 to 3 seconds that we just talked about. You're still going to try to time this up with your breathing, so when you inhale, you're nice and relaxed. But this time, instead of exhaling for 2 to 3 seconds, I want you to purse your lips and slowly blow out like you're blowing out a candle for 5, 8, maybe even 10 seconds. But during that exhale, I want you to think about contracting and lifting up your pelvic floor and holding for that 5, 8, or 10 seconds. I want you to repeat this 10, 15, 20 times if you can. Sometimes after surgery though, you won't be able to do 5 or 6 in a row, and that's okay. The pelvic floor is very fatigued and tired and not sure what you're asking it to do right now. So take your time and be patient with this recovery. These are great exercises for you to start doing after your surgery and once the catheter is out. But know that it does take time for these muscles to respond to what you're doing and what you're asking them to do. Just think, this is like no other muscle group throughout your body. It takes time to build strength, it takes time to build endurance. So be okay with it taking time and be patient and kind to yourself while you're learning. Also know, around 3 months after your surgery, if you're feeling like you hit a plateau in progress, You can always reach out to your doctor to get a referral to see if pelvic floor physical therapist, and we can help you kind of fine tune your home program and get you on exercises that are going to fit your needs.